Great. So welcome, everyone. This is the first time that we've actually very intentionally brought together both school districts and local boards of health. So I see, over 1,000 participants here today. And so really glad that we can share this information and answer your questions. You'll notice that we're in the webinar format here today. So just keep in mind that as you have questions, please put them in the Q&A. The chat is disabled, so don't try to use the chat. Use the Q&A, put your questions there. I'll make sure we have plenty of time for your questions. That's really where we're gonna take your questions. And so I'm not able to respond to the hands that I see raised. So throw your questions into the chat. We'll make sure that we get to you throughout the webinar, particularly at the end, where we're gonna really focus on your questions. So we know that you've come with them today. We very intentionally put out that memo yesterday, so you had a chance to read it, maybe digest it, and then come to us today with your questions. We wanna make sure we're here for you in that regard. So let's just jump on in and look a little bit more at what's going to happen in this discussion today. As always, here's our team. And you see a lot of us here with you today. We're also so pleased to be joined by Dr. Larry Madoff from DPH. And we're all here to assist and help and provide you with information. So a lot of what we're going to talk about today is in the memo from yesterday, but I hope that my voicing over and kind of emphasizing some information just help to bring it to light for you and help to answer some of your questions. And so we're going to just start by looking at our data, talking about the new options. I'm going to slow down and not talk like an auctioneer, and in the middle kind of summarize those options, give you some more information about the additional at-home antigen test that we're making available, how that impacts our quarantine guidelines, and then talk about our next steps. So I hope it sort of laid out for you in a pretty logical order, really matches and mirrors what you saw in our memo that we released yesterday. And as always, my colleagues are going to stop and interrupt and make sure that I stay on track and do not lead you astray with any information, and I will always pause and see what they have to add as well. We're so pleased to have them all here. So we know that this is all about promoting and protecting safe in-person learning for our students in Massachusetts. We are so appreciative of your ongoing efforts to keep our schools open. And we know that the mitigation strategies that you've put in place, and we very intentionally put vaccinations first, because we know that's our high priority strategy for helping to get past and through this pandemic. But we know how important mask wearing and testing are to really just promote and round out so many of our mitigation strategies. And as always, we think about a layered approach. And so we've brought a layered approach with our current testing program, and the new option that we're presenting to you is also a layered approach to testing. And we are so appreciative for all your hard work in making these things happen to keep our kids smiling behind their masks. So, when we think about our statewide testing program, it's really been built on adaptability. And I know that, it feels like longer than 2 school years here that we've been doing testing, right? So we've done testing in our state since the fall of 2020, right through now in 2022. And when you think back on the beginning of the program, what we first offered to districts was the mobile testing unit that we could send out on demand. And then we introduced Buy Next Now, and we introduced pool testing. The program has continually adapted, and it's really adapted based on a few different things. Data in particular, what do the data tell us about safety in our schools? It's been about what type of technology do we have available, what tests are available, and the feedback that we get from you. What do you need? And so again, I feel like we've tried to use those 3 components to bring you really the best array of options. And now we have a new array of options that are really built on those same 3 things again: data, available technologies, and your feedback in terms of what's working and what's not, and what we need to improve. So, again, we've built our model on what we know from both our data and data from outside of Massachusetts to bring hopefully the best possible testing options to you and really to optimize in-person learning. So I just want to begin by talking a little bit more about those data and what do the data tell us about how testing is helping to keep our schools open. So just going back to, again, those early days from this school year, I know it feels, at least for me, it feels like it's been more than a year, but it was just last fall that we introduced Test and Stay to really help close contacts stay in school. And we know that it was very welcome, but it's also been a challenge. And so some of the feedback that we've heard from you is it's a strain. There's a trade-off in terms of the time that it takes to implement test and stay, and also, what we get for it. What we've gotten for it is amazing. It's been great to keep our kids in school as much as we have, but we're also just mindful of, are there other ways that we can go about providing testing options that perhaps lessen the strain, particularly on our school health professionals, who we are particularly grateful for. Our nurses, the school nurses, have been amazing and diligent and hardworking. And there's so much that they need to do beyond testing as well. And so we've implemented this model, seen great success. 98% of the tests that we have offered in schools have been negative. So test and stay, all those close contacts that you've been testing in school, 98% negative. And I know that, I've mentioned before that in the latter part of the fall, actually it was in December, our testing team from HHS and DP and DESE, we went around to some different schools in the state and sat down with school leaders, district leaders, public health coordinators. And one thing that really stayed with me a lot from a conversation that we had with a public health leader was, we're doing so much testing of people who don't have symptoms. When will this change? When will we, this has been good and helpful, but there's nothing kind of like it where we're doing such ongoing testing all the time of people who don't have symptoms, who are regularly showing up negative, 98% of the time in this case showing up negative. What can we do to evolve? And I really appreciate the challenge that person presented to us. Why we go and listen, and that's why we want to show up and be in schools and find out what's happening on the ground, because everything we need to do needs to continue to be in support, just like test and stay has been, and keeping school students where they thrive, which is always safely in school. Other data really help to promote, what we've been doing, and also helping us think about an evolution. And overwhelmingly, data just continue to show us that students are very safe in school, and that while there is some transmission in school, it's very limited. And so when we look at students who've been in test and stay, right, if you are identified as a close contact, what is the likelihood that you will perhaps pass the virus on to somebody else in the school? And the data that we have, particularly from California and Illinois, that the CDC cited in their guidance around test and stay, was these extraordinarily low rates of secondary transmission. And so we just know that close contacts in school are very unlikely to contract or spread COVID-19, which just gives us a lot of kind of confidence about, if we know that's what's happening when we're really closely monitoring that, then it sort of gives us that confidence to say, well, let's recommend an evolution to our testing program and a new way of approaching testing in school. And again, taking those combination of factors into place, these data, plus what we have available and your feedback, really leads us to what we want to introduce. And the good news about this is that we're not the first, right? We've been watching and learning from other states like Vermont and Connecticut that have moved away from individualized contact tracing and introduced an at-home test component in varying ways in both states. And we're like them, but not exactly like them, to really help to focus our school health effort, the efforts of our school health professionals on symptomatic testing. Let's really make sure that we're kind of continuing to offer a variety of ways of surveillance testing, but in school we want to make sure our school health professionals can focus on symptomatic testing. Is really kind of what we're doing and what these other states have done as well. And so let's just look a little bit more then at what are we offering now and what is this new option. So I do want to slow down here and make sure that I'm being very clear about everything that lies in front of you in terms of the choice that you will make in terms of continuing on with the current option that we have for you that includes often symptomatic testing, pooled testing, and test and stay. If you do nothing, you stay where you are, right? So that is an option. But we are really excited to bring to you today this option of if you have in place either symptomatic and or pooled testing, right? As long as you have one or both of symptomatic and or pooled testing, you can discontinue contact tracing, discontinue contact tracing and test and stay. One of the key things that we put into our memo, and we were really deliberate about, it's a footnote in the memo, but I wanted to kind of highlight it as the middle bullet here, is that school health professionals can continue to use their professional discretion to determine specific situations that still warrant contact tracing. We wanted to make sure that we're clear that it's not like against the rules, it's not forbidden. We expect it to be, discontinued is the word that we're really focusing on. But we really trust the judgment of our school health professionals. And if they say we need to do some contact tracing, we want to give them that latitude to say you can still do some, really at your discretion. But overall, we're trying to move away from sort of individual contact tracing, and instead think about how, as an additional resource, we provide the rapid antigen tests for all participating students and staff. And I want to just pause for a minute on all participating students and staff, or staff and students as it's written here. So what do we mean by participating? Staff and students are asked to sort of commit to wanting this, to saying that that they want to actually have an at-home test. And so we're asking for families to decide whether or not they want their children to opt in to receiving an at-home test, and for staff to do the same. So we're really separating out the idea of consent that we need for pooled testing, that we need for symptomatic testing, that we need for test and stay. So we need consent for those types of testing because we share information between the district and a third-party vendor. So consent is needed, informed consent is needed because personal identifiable information is being shared with a third party. With the at-home tests, there's no third party involved. And so it's an opt-in instead of a consent. But we do need to make sure that our staff and students, and really families, definitely want to participate, and those are the individuals that we absolutely want to get tests to. But at the same time, if somebody doesn't want it, we don't want to be just sort of giving away this resource and not having it go to good use. And so we are asking, it's a pretty simple process for opting in. We'll show you more about what that looks like a little further on in this presentation, but I just wanted to pause for a minute and separate out the consent that has traditionally been associated with our testing program with the opt-in that now exists just for the at-home tests. And any family can choose to opt in, whether or not they're participating in our testing program now or not. They can decide whether or not they want to opt in. Promised I would pause and just see if there's anything that my colleagues want to add. So Jeremiah, Lauren, anything that I'm missing there so far as we go?
Not for me, Russell. It was great.
All right, well, we'll keep it going. I'm sure that I will need you soon. I always do. So our new option that, it's why we wanted to make sure we brought together both school and district leaders and officials from local boards of health to make sure that it's clear in our memo that we recommend for districts and schools that select the new option to notify local boards of health, because we really appreciate that collaboration, so that local boards of health are well aware of what the school and district is planning to do. And that, again, I just want to reiterate that it's available for districts that either are continuing or starting symptomatic and or pooled testing. So if you're a school or district that's listening right now and you're not part of our testing program, or you're not doing symptomatic or pooled testing, it's not too late. You can still join in. And if you are already involved, it's then very easy for you to fill out our survey. The link is in the memo that we released yesterday. It's in this presentation as well, so that you can decide to come in and join the new option. If you choose not to switch over, if you choose to stick with our original testing options, then you would not be eligible, to receive the at-home test for students and staff, for participating students and staff to take on a weekly basis. So that's the kind of the line between the two that we just want to make sure we're really clear on. And I'll just summarize that again in a minute with a table that we've included to hopefully just make sure that this is all very clear. We very much appreciate the support that CIC Health has provided to this entire testing program, both last year and this year. And I think a strength of our program too is CIC's adaptability. And so we have many of our program coordinators from CIC here with us today. Many of the CIC staff are also here. We really appreciate their willingness to continue on providing support under the original program, but then also adapting their supports for the new program. And so we are, continuing to discuss exactly what the new supports will look like. Again, based on questions and feedback that we're getting from you, we are talking every day about scenarios and what will this look like, just to make sure that as we make this shift, that the staffing support from CIC will continue to be available appropriately for you. But keep in mind things like your ordering of materials. So when you go to order, for example, ultimately, your ordering for the at-home test will go through the CIC ordering portal. So it's one-stop shopping. So ordering materials, managing consent, right, for pooled testing, for symptomatic testing, that will continue to happen through CIC. So a lot of what you've gotten used to will stay in place. And then they'll also help to support, particularly, for example, the ordering process for the at-home test. So again, very appreciative of the support we have there from our partner at CIC. So how long will this last? Really important to note that we are saying that the new options and the current testing model will be in place through April 22nd. And all we're going to do is just reevaluate. We didn't want to say that this will definitely be in place for the remainder of the school year, because we're constantly evaluating the effectiveness of our testing program and the options that we bring to you. So, it could be that we get to early April and we announce to you, yeah, we're going to extend what we're currently doing. Or we might get to April and say, we're going to phase out a portion of our program. We're going to add something else. But I think we just want to take the school year in kind of specific intervals. And so right now, our interval is from, kind of January up through after April break. And at that point, we'll make sure that you have plenty of information about what to expect for the rest of the year. But I think that just sort of having some bookends on where are we right now just maybe supports your planning and your communications, so that we can help you with this transition. And so again, if you have questions about the dates, though, please feel free to put them into the Q&A section of our webinar here today. So let's just look at the summary of options. I kept trying to make this bigger. I hope it's fitting on your screen right now. And this could be a useful slide for you to share, any of our slides, obviously, the data and anything I've shared so far for you to share with your own school and district communities. But I think this really helps to kind of sum up what's available under the updated options or the original options. So, as I mentioned before, to be a part of the updated testing options, you have to have in place symptomatic and/or pooled testing. So yes, it's available under the updated options and it's available under the original options. Test and stay goes away under the new options, stays in place as a choice, right? You don't have to do test and stay, but it's a choice under the original testing options. Individualized contact tracing for in-school exposures, not required under the updated testing options. And yes, it does continue on under the original testing options, because that's how you identify students for test and stay, or individuals for test and stay. And then the weekly at-home antigen tests, yes for updated and no for the original. Keep in mind for where we say yes, we're going to begin shipment during the weeks of January 24th and January 31st. So, keep in mind that, shipping takes a few days. So for example, if you respond to our survey by Friday, let us know that you want to start the new option. We will begin shipping tests to you for your staff, and it's all of your staff, starting next Monday. And so during the week of the 24th, so Monday through Friday, and it won't be Monday, right? Because we're going to start the shipping on Monday. So let's say Tuesday, Wednesday, Thursday, Friday, somewhere in that interval is when you would receive your shipment of tests, your initial shipment for your teachers. And the same thing will happen next week for the students. Lauren, Jeremiah, anything you want to do to kind of highlight or summarize anything else from this table, just to kind of breathe any further life into what we're making available?
There are some questions. Oh, go ahead, Jeremiah.
I was just going to say, I don't think so. I've got my hands full, but I think that's right. Thank you, Russell.
Thanks, Jeremiah. Lauren, go ahead.
Everything that you said was right, Russell. There are some questions about when can people who are opting into the updated program actually stop the contact tracing and test and stay. And what our guidance is that you can stop once you have your tests in hand, your at-home test to be able to give to families. So again, those districts that apply by the 21st, we hope to be able to get you your test in the next couple of weeks so that you can stop the contact tracing and test and stay during the week of the 31st.
That's right. So 31st is a Monday. If you get your test and you're ready to start giving them to families, let's just say on Thursday of that week, that's the day that you stop doing test and stay and contact tracing. Is that day that those at-home tests start to go home. So it's a really clean line between the two. Let's just look at some more information about those at-home tests. So again, I've mentioned that we've got the survey link for you to click on. It's in our memo. It's the same survey link here. And so, you know how I mentioned that the new options will be in place through April 22nd. So we're giving you up until April 1st to decide if you want to change over to the new option. So we've given you this priority deadline of January 21st to get in so that you start getting your tests for your staff next week, your students the week after. But you might decide that there needs to be some more local discussion. Maybe you want to involve a school committee or your board of directors. And so, you know, it might be that you need a little more time. That's fine. We've given you up until April 1st to decide to change over. And we're certainly encouraged by the early responses that we're already getting, though, of schools and districts signing on so that they can be ready to start getting those at-home tests next week. So I think we've talked about these dates in the second bullet, but hopefully just good as a reminder. Again, as we start the new model, staff delivery and student delivery will be on separate weeks. I'll say a little bit more about that in a minute. So we already talked about the districts that are not currently signed up. So if you are not enrolled yet in symptomatic and or routine pool testing, we need you to do so if you want to switch over to the new option. And so, you know, like if you're only doing test and stay right now, or you're not doing any testing, any of our statewide testing, you need to go in and start the process from the beginning and complete our updated authorized school application. That might delay your start date, though. It just depends on how much needs to get done to get you kind of into our testing program, and then for you to complete the survey to tell us how many of the at-home tests you need for your staff. So, you know, if everything's good by Friday, I'm sure you'll be ready to go. But if you are not yet in our testing program and you need to take that, you know, do that authorized school application first, it could potentially create a delay for getting started, but that's a very small number of schools and districts that would apply to. So how will this at-home antigen test program work? So again, we've really highlighted here that it's available for staff members and students who choose to participate. So staff members need to opt in, and the families and guardians of students need to opt in. And we'll share with you what the opt-in form looks like and where to get it in just a second. And on our webpage, we actually have available for you the forms. So they just went live. So if you go to, we always want to direct you to our updated testing program page of our website. That's where you will always find our testing resources, and our opt-in form is, as of right now, available there. We're really excited to have it ready and live for you. And so a really key thing, though, and kind of one thing that is different about our at-home tests is that they're available to all participating students and staff, regardless of vaccination status. And so, you know, that does increase the number of students and staff who are eligible to participate in this testing, because, as you know, vaccinated individuals cannot participate in test and stay, and vaccinated individuals are not recommended to participate in pool testing. We're making the at-home tests available for all participating students and staff. So our reach will, you know, perhaps be larger, and accessibility is broader with the at-home tests, and we're really excited about that. So the test will come to an internal distribution location. So you're going to notify us where you want the test to be delivered to. And I think we say this again in a minute, but they come in packages of 2 per kit. So each individual, if you have a staff member participating, they're going to get a kit with 2 tests in it. And then they would take one test one week, the next test the next week. And so it always comes in kits of 2, same for the students. So families will get a kit that is meant to last for 2 weeks. So it wanted to just name to you which at-home test it is. It's the iHealth test, which a lot of you have familiarity with because the Baker administration provided, these are the tests that the Baker administration provided in December to 106 communities in the state. And like I already mentioned, it's one kit every 2 weeks. And so, particularly the districts that are doing pooled testing, we ask that you think about how to maximize the utility of the at-home tests, balancing it with what day you're maybe doing pool testing. So let's just say you're a district that does pool testing on Mondays, or a school that does pool testing on Mondays. We might recommend that you then have the at-home tests. You're giving them out so families have them, so staff have them, maybe for a Wednesday or a Thursday test, so that you're dividing it up. And really I think a key message of this, perhaps for you locally, and definitely if you're doing pool testing, is that you're now making it available for staff and students to take 2 surveillance tests a week, one through pool testing, one through an at-home test. So the level of coverage that's available here is really broad, and you can still choose to switch over to pool testing if you want. But the idea is that everyone has an opportunity to take a test twice a week. There aren't too many other places in the state or in the country where people that are part of a particular affiliation or institution can get 2 tests a week, 2 surveillance tests a week, and minimally 1. So I think our coverage is really strong here, and what we're offering in the way of kind of ongoing surveillance, I think is pretty exciting. So again, I'll just pause to see if there are any points to make. I think we had one more so I'll just say one more thing about kit distribution and use, and then pause to see if there's anything else to add. So for the next few weeks, we're going to stagger when staff kits go out to you and when student kits go out to you. So that's the beginning point of the distribution schedule. Ultimately, we anticipate kind of merging so that you'll get all your tests in 1 week, but we'll follow up with additional information about that. But let's just say you join after the 21st, you're going to be added to the existing distribution schedule. So let's just say you come into our testing program next week. We'd want to get you started with the student distribution on the week of the 31st, and then likely the staff distribution perhaps the next week. We'll work out some more details there, but I just didn't want to set the expectation that if you come along later after the 21st, that you'll automatically start getting those tests for either group out of order. We'll maintain a sort of constant order of at the very beginning of our schedule. And so we'll keep you updated on that. And if it changes, we'll keep you updated too. But just wanted to start by setting the expectation of a kind of staggered distribution schedule. Staff 1 week, students the next, in the very beginning of this program. But like I said, let me see what additional information my colleagues want to offer. So Lauren, Jeremiah, anything you want to chime in there with? All right, I'll keep going to make sure we have plenty of time for questions. So let's talk about those results. So when an individual tests at home, let's just say it's a student, what's the expectation of what they do with the results? Well, we particularly want to know what the positive results are. So we ask that parents, and this is something that they will commit to in their opt-in form. So when the parent opts in, they are telling us and telling you, really telling you, that they will report their results back to the school if they are positive. And we've created a template response form, so it's optional. It's an example response form that you might use for your families to be able to tell you that they have a positive result. And we're going to talk a little bit more about that. And Maurice is going to chime in pretty soon about how we're making that available to you through Google tools as well. But you're not required to report those results of the at-home test to DPH, but you will report them in your weekly report, your weekly data that you share with us in the weekly testing report that we then put out every Thursday. So the results don't go into Maven. They don't. The at-home test results don't go to DPH, but we ask the districts continue to count them for the weekly report that they share with us. Anything else about results that I should add? So, sorry, Lauren, go ahead, please.
Oh, no, I just said no.
All right. So on our webpage, and again, we've linked this a lot in the PowerPoint for you. Let's just talk about what we have to help you with this and to help introduce this new option to your community. So first of all, we've got a template letter to explain how this new option works and how the at-home tests work for your staff and for your families. And it includes training information for the at-home tests and information on reporting results. It's also translated so that for our families, so that they get the information they need in the language of the home. We've got an optional template opt-in form for staff and students. We have a template test result for individuals to report their positive results to the schools, a test distribution tracking sheet, and we will soon have in CIC's ordering portal available for you a way for you to select the number of at-home tests that you're going to need right through their portal. So we're excited about having these resources available for you. If there are others that you need, please let us know and we'll make sure we continue to provide you what you need. But Marisa, let me turn it over to you now to explain more of the resource that Shaw's making available to support the opt-in forms for parents. Just tell me when to advance the slide as well.
Great, thanks Russell. Hi everyone. So what we've done is we've taken the templates that DESE has created, as well as all of the translations that are available on DESE's website. And we've created a Google form for schools to use. And this is, that the template that DESE's created, it's optional for use as Google form. You might have another way in which you want to collect your opt-ins for this antigen testing program. But if you want to use an electronic form, we've created one for you as a template and making that widely available for districts just to take the burden off of schools. So this form is a single form. It's used to collect opt-ins for both staff and students, and it has translations available for all of the DESE translations in English, Spanish, Portuguese, Haitian Creole, Vietnamese, and Chinese. Russell, you can go ahead and go to the next slide. So the easiest way for us to ensure we can get this into the hands of each district who wants to use this form is to share a Google folder with us. Our email is here on the slide. It's covidedtesting@shawfoundation.org. Create a Google folder, share it with us, and we'll drop in the template for you. We can help walk through any questions that you might have as you get it set up, but we've tried to make it as easy as possible. So all you have to do is go in and adjust the form so it has your district name in it and plug in the schools in your district. From there, it automatically connects to a tracker sheet that helps summarize number of students and number of staff who have opted into the program so that you can easily keep track of all of that information in one place. We've also done this for the results reporting form as well for anyone who wants to use that template and is looking for a really easy way to make this an electronic form if you don't already have another way to collect positive results. Lauren, any other things that I'm missing here that you want to add in?
No, I just think it's a great optional resource if districts want support in creating online forms for the opt-in process. And so please utilize the Shaw Foundation as needed.
Thanks. Russell, I'll pass it back to you.
Thanks, Marisa. Really appreciate it. So thinking about the quarantine guidelines and what's the impact on quarantine. So the districts that select our new testing program, the new testing option, can discontinue individualized contact tracing, just like I just mentioned. And so the expectation is not that close contacts will continue to be identified, and therefore any potential in-school close contact, any potential in-school contacts do not need to quarantine. And we really want schools to really shift towards the monitoring of symptomatic individuals. And we will very soon update our protocols that I know you rely on a lot just to reflect these changes. And it'll be an opportunity for us to, and if we make other changes to the protocols, of course, we will explain those to you in an upcoming webinar. But I think this is an important point that, we're as we focus less on close contacts and the quarantining of potential contacts, we're really trying to focus as much as we can on symptomatic individuals as we continue to go forward. So let's just talk about some next steps and any other notes. So key dates, you've heard me say that by January 21st, if you're interested, please complete our survey. During the week of the 24th, if you responded to our survey, you will begin to receive tests for participating staff. So the 24th, the week of the 24th, is when we will have at-home tests available for staff. We're going to ask that by the 28th, you let us know how many opt-in forms you've collected from families and submit the request for at-home tests through the CIC portal, which you'll find very easy just to put the numbers in through the portal that you're requesting, just like you do for your other testing materials. During the week of the 31st, just like I mentioned, not on the 31st, but during the week of the 31st, you'll begin to get those tests for the at-home tests for participating students. And once you start distributing those tests, just like we talked about earlier, that's when you can discontinue contact tracing and test and stay. And then after the 31st, you'll just continue to update the CIC ordering portal, and we'll provide you with any other information that you need. I think maybe I just want you focused on how to get up through the ordering that you need to do by the 28th. And as we have more information about ordering after the 28th, we'll keep you updated and keep the information coming to you. So just other important reminders, you've got from the 21st through April 1st to determine if you want to switch over to our new options. And so, it might be something that you kind of want to, move towards and set a date and talk with your community about. That's fine. We, just hope that you'll, again, kind of balance everything out and figure out what's best for your local community and act with appropriate urgency to make this decision anywhere between the 21st, really now, and April 1st. And, other, like I mentioned, schools and districts that come in after the 21st will just sort of, be folded into the existing distribution schedule. I would be remiss if I just didn't continue to put in a plug about our mobile vaccination program. Really excited that we continue to offer this for you. I think a really key thing to remember is that when you click on this online form and request an a mobile vaccination clinic, keep in mind schools are prioritized for this. Our colleagues at HHS are really looking out for when do schools come through so that we get those mobile vaccination programs to you as quickly as possible. It's usually about 2 weeks, but keep in mind that, we're doing everything we can to prioritize clinics for you. And I think we are just north of 920 clinics that have been offered in our schools. So I know Governor Baker talked about that yesterday, just really happy about the number that we've been able to offer, and we want to give more. We want to keep those vaccination clinics going. So don't hesitate to click on that link and respond with your interest as soon as you can. As always, we just want to make sure you know where to go on our website to find what you need. Everything that we've been showing you today, and particularly the resources we have, the optional templates for you to use, are all on our testing program webpage. On the desktop page is where you can find our protocols and our updated flowcharts. And then our general FAQs are posted on this page. So yeah, just hope that it's helpful to kind of know where to go to get what you need. Then finally, just that reminder of kind of how to get help, and appreciate how many program coordinators are here with us here today. They're always your best line of defense. You can always raise the flag to CIC by emailing them. CIC provides us with excellent information about how quickly they're responding to questions that come in through their support center. And then, to reach out to us or the Shaw Foundation for any additional questions or concerns. So that's it for our presentation for today. I will stop sharing so that we can hear what your questions are. Keep in mind too that if we don't answer your question today, we're very deliberate about making sure that we take them under consideration for future webinars that we'll be doing. We know you're going to need more information as the weeks go on, and we'll also make sure that we consider what needs to go into any updated FAQs as well. So Lauren, really glad to turn it over to you to see what we have in the way of questions.
Sure. Russell, that's spot on, because we got hundreds of questions in our chat. And so we will definitely not be able to get to all of them, but like Russell said, we'll look to update our FAQ to be able to answer all of them. We did get a lot of questions just about the slides and where they can find them. They will be posted to our COVID-19 testing webpage, but I've also just put them in the chat for you to download. So you can have them where the links are live. And then once the recording and the slides are up, we'll send an email to everybody to let you know that they could be accessed there. So a couple of questions, Russell, came about wondering if districts can choose to opt in only certain grades into the program, or does it have to be a whole district choice to discontinue test and stay and have the at-home testing option?
Yeah, I appreciate the question. And for right now, our answer is that it's the whole district. We do want it to be just sort of an across the board decision. We think it's a decision that affects the whole community, and one that, also to make sure that, we can get you what you need is to have it clear that it's for the entire school or district.
Great. And related to that, districts are wondering, can they only have staff participate and then have students continue with test and stay?
Yeah, once you, when you fill out the survey that we have the link for you to, you're going to tell us that you want to join this new option. And so it really would be across the board. We wouldn't have some people doing test and stay and some people doing at home. Once you take the survey and you tell us that you want to join the new option, it then discontinues the old option of continuing on with test and stay across the board.
Great. So districts are wondering if they do switch and they say, we're going to either do symptomatic or pool testing, and we want to do the at-home antigen test. Can I require the students who want the at-home test, who opt in, to also require them to participate in pool testing?
Yeah, it's a really good question. The answer is that, you can't, we oversee the structured learning time requirements. And so you have to make sure that you're providing that opportunity for students to get their structure, their learning time in during the year. And so our answer is you cannot make it a requirement to participate in pool testing or symptomatic testing. We hope that, you can impress upon families that it's highly recommended and that, we want you to be able to join. But particularly the school day itself is something that cannot have a requirement in order to gain access to learning, to the classroom, to in-person learning, or any type of learning. You have to allow the students into school, and that can't be a barrier for them to be able to come in.
Great. And so then for districts that do decide to take up this option, what happens to students that don't opt in to take the rapid antigen tests home?
Yeah, so they're not required to. So again, I think it would be continuing to work with families and get more families signed up. I'm imagining that as this goes on, hopefully, you'll increase your numbers every week of who's participating. And so again, it's not a requirement. We're planning to come back to you in the coming weeks with more information about how to increase the opting in and how to increase the likelihood that parents are administering the tests at home. So we want to get you started with this information today, and then come back with more information in the future, but it is not a requirement for anyone to have to do the at-home test.
Great. And so there were a lot of questions about why districts need to seek additional opt-in for these at-home tests when the consenting process was time-consuming for pool testing or symptomatic testing. So I think it would be great, Russell, if you could just review the differences between consent versus opt-in for people to just get a clear understanding.
Yeah, definitely. So keeping in mind that, consent is a much more legal process. It signifies that we are sharing information, student identifiable information with a third party. In this case, the information that goes into Crush the Curve, the information that, the lab has, it's leaving the school and it's going to a third party. And so we have to have informed consent for that. In this case, we want to make sure that we are providing the tests to parents who are kind of willing, ready, and able to administer those tests at home. And so the opt-in it's a lot more simple, and I hope that it's not really a time-consuming process. And really appreciate the Shaw Foundation's support in making that an online type of thing, a Google form that our parents can fill out very easily to just signify their interest. But we really want to make sure that we are providing these tests where they'll be used, and that they'll go to good use, and really support the kind of layered mitigation strategies that we have in place. So again, a much more simplified process, but still one that just requires parents to actively say that they want to participate, and staff as well.
Great. Is there a required amount of participation or opt-in among students and families in order to participate in the program?
It's a great question. That came up a lot when we were designing it. And again, we really feel like we hope that opt-in numbers continue to grow. And so as soon as you start telling us that you're ready, that you have people opted in, that you have staff opted in, we just want to start shipping you tests. And so there is no minimum requirement. We hope that there'll be a lot of interest, like, families, staff. We have a free weekly test, and all you have to do is just fill out a very simple form for us. We hope that there'll be, a decent level of interest, and we hope that we can help you grow that interest throughout the rest of the winter as well.
Great. Sorry, just looking. Districts are wondering if their pre-K programs can be eligible, their district-led pre-K programs can opt into this.
Yeah, and Lauren, Jeremiah, correct me if I'm wrong, but there's nothing, the iHealth test goes down to what age? 2. Excellent. Thanks, Jeremiah. So yes, we've made our testing program already available to the pre-K programs that you run, right? So this is the in-district pre-K program that you administer, that is part of your public school district. Yes, our testing program is already available for those students, and this would be as well.
Great. And so there's some questions about, so we're asking families to report positive results, and we're sending the test home and asking families to administer the tests. What if they don't do that on a weekly basis? Are there consequences for families who have opted in, or staff that have opted in, but then don't actually administer the test?
Yeah, I think, overall, I'd say that's a local decision. We'd ask you to work with families on that. I would hope that it's not sort of a penalty type of thing, but much more of a just, communication and collaboration effort that really just impresses upon families and staff the importance of particularly letting you know about the positive results. So that's really where the key information is that we know that you need, are those positive results. And, we hope we would, gather more information for you too on good ways to overcome that type of barrier that we can bring to you in the coming weeks as well.
And Russell, it's correct to say that in the same way that pool testing or symptomatic testing can't be mandated, a student cannot be barred from attending school if they don't administer the test at home. It can't be a requirement to attend school. That's right.
That's right. Really important that this is not a barrier to the kind of, how sacred we feel in-person learning is.
Great. Dr. Manoff, this is actually a question for you. There's a lot of questions about, so we're not going to identify in-school close contacts, but what happens to any out-of-school exposures? And I know we talked about this earlier in the week.
Yeah, so thanks, Lauren, and thanks for asking me to join you today. I'm happy to be here. And I also just want to thank all the participants for, what we at the department recognize has been an incredible amount of work and I think success in the schools this year. And thank you for everything you've done. We are asking that exposures and contact tracing that's done, that occurs outside of the school setting, be in the domain of the local Board of Health, and that the rules around exposures and contact tracing and quarantine that would apply in the community apply in those settings. So it would be a separate setting and would be run by and administered by the local Board of Health.
Great. So there are a lot of, Dr. Manoff, I'm going to kick this question to you again. There's a lot of questions about for people who have previously tested positive in the past 90 days, can they utilize these at-home tests?
Yeah, that's a great question, Lauren. So there are two kinds of tests that are frequently used for detection of COVID. The sort of the gold standard and the one that's been around the longest is the PCR or molecular test. And that's very sensitive to very small amounts of the virus of SARS-CoV-2. And that can remain positive for quite a while after an infection. So we see people who can be persistently positive on those tests for weeks. On the other hand, the antigen tests, the rapid tests that are being used in this program are sensitive to the larger amounts of virus. And so they correlate well with people who are in the phase of infection that's most likely to be transmissible, that's likely to be associated with the acute infection and not persist for a long time. So the antigen test is really an accurate reflection of sort of active infection. And you can continue to use it. Now, most people will have some degree of immunity for a time after their COVID infection, and we use 90 days as kind of a convenient window. But some people do get reinfected even within that 90-day window. So when an antigen test turns positive, it should be regarded as positive. In fact, that's a major message that DPH is trying to get out, is that an antigen test that's positive is a good indication of COVID infection and should be treated as a positive case. It doesn't require follow-up testing or anything else. It's a positive is positive.
Great. And then Russell, just one more reminder about the results that are reported, the positive results are reported. Where do they go? And where do they not go?
Right. So the positive results are reported to the school. The school then collects them as part of the data that they share with us, DESE, on a weekly basis. But as with all at-home tests right now, the at-home tests, and Dr. Madoff, feel free to chime in on this as well. But if I were to go to CVS and buy an at-home test, those results would not go into Maven. They would not go to DPH, nor will these at-home tests go into any kind of statewide data collection through DPH.
That's correct. It's the same. It's the same as the tests that you would buy at a pharmacy that are at-home tests. They are not reported to public health.
Can I add one thing there, please, which is just so families should notify schools of positive results. That's the key thing. They should also talk to their healthcare providers.
Oh, thank you.
So that actually is an entry into the state's case tracking system. So please advise families, as I imagine I would if I had a child that's positive. They should talk to their doctor.
Yeah, thanks, Jeremiah. Appreciate that reminder.
Great. I don't know, Sean or Jeremiah and Marisa, I know that you're also looking at the questions if there's anything that really pops out to you. Otherwise, we have so many questions that I think our team needs to go through them and develop a document to be released soon to compile them and answer them.
And maybe just a reminder that families can opt in at any time. On our webpage, we have the opt-in form available in translated versions. So really hoping that helps with accessibility. And we look forward to just coming back to you with more information in the weeks ahead, because we know that this is a change and it needs to be coupled with information and even further answers to the questions that you've posed to us. Any final thoughts?
I did see one thing. I saw a lot of things a couple times in the chat, and Laura, I think you're right. We just need to dive in. There's about one question for every 2 people that are on the webinar in there. But one thing that I saw a lot was the if we can't get everything in line by this Friday, can we still join the program afterwards? And the answer is yes, absolutely. Just want to be clear that districts that are able to get their information into us by Friday, we have a guaranteed start date for them. But for districts who just cannot pull it all together or want a little bit more time to think about it or whatever you have to do, yes, of course, the door will be open. We just don't have like a timeline laid out in stone for you yet.
And also just a reminder that, I see questions about the staffings provided through CIC Health, and, we intend to, keep the staffing in place for you to be able to have, support for pooled testing, and then other forms of support that you're used to them providing now, we want to keep in place, while also, further determining what supports they can provide for the new option as well. And so what you've relied on, we want to keep going with, and what's new, we want to support as well. Great. All right. Well, we are just right at time. So really appreciate everyone being here today. Appreciate the combination of interest that we have both from local boards of health and from school districts. So thank you for your time and attention, and we look forward to following up with more information soon. Hope to hear from you by the 21st, and if not, then anytime thereafter. Thanks again. Have a great rest of the day. Bye-bye.